Well, welcome to the podcast, everyone. I'm Marcy Markusa, your host here in Manitoba. You probably figured that out because we're called This is Manitoba. If you're brand new here, welcome. And if you're coming back for more, thanks for being with us. Today, we're looking at issues that come up in school settings. One of them, especially this year, is AI, artificial intelligence. There's been a whole deal of conversation about how that can work to benefit Manitoba students and all students in schools. Some are saying we need better policies. Today, we thought we'd go to our Gen Z panel, and we'll hear from them in the podcast about how they use AI, not only in classrooms, but in their daily lives. What's that look like? What are they worried about? And what are they hoping improves? But we begin with a story of a Manitoba mother who says when it comes to the issue she's having in school with her young daughter, AI is not going to help. She needs help from someone in person so she doesn't have to run back and forth to the school to help with the insulin pump that her daughter uses. So the mom I'm talking about is Ashley McKague. She's the mother of an 8-year-old named Anna. Anna was diagnosed with type 1 diabetes when she was 3 years old, and she has an insulin pump. Anna's getting ready to enter grade 4 this year at Sam Berlin School in the Louis Riel School Division in Manitoba. But since her diagnosis, her mom says that she or another family member, as I alluded to, have to help Anna at lunchtime to administer insulin and monitor the pump. That is because Manitoba's healthcare plan for type 1 diabetes in schools and daycares only allows educators and support staff to monitor insulin levels, but not actually to take the step and give the injections. It is something that Ashley hopes will change, and here's what she shared about her experience.
Hi, good morning. Thank you so much for having me.
So give me a picture of this. Does Ashley come home for the injection, or do you go to the school, or how does it work when you're trying to help out?
Yeah, for sure. So right now in Manitoba, myself and all parents of type 1s that have children that are young or with a cognitive disability that are not able to punch in the numbers themselves on their insulin pump, you got to do the lunchtime hustle and run to your daycare or school, run back to work. And it can be extremely challenging because most people's work and their child's school or daycare isn't a few minutes away, or lunchtimes don't line up. So it can be extremely challenging. I know folks that have had to reduce hours or quit their jobs for their children to healthcare. And it's actually the only medical need that parents are expected to deliver in schools.
You have gone to the school division in province about your concerns. What response did they give you?
Yep, the school division, they've been very supportive of Anna and her diabetes, and absolutely wonderful. Samuel Berland and Louis Riel, we've got to give a huge shout out to her teachers, administration, and they follow the plans extremely well. And as far as her sugars, if she's going to go low, they'll remind her to have a juice. When she was younger, they would give her that juice if she needed, that kind of thing. Wonderful. And they have said, the assistant superintendent told me they follow the URIS Manitoba Health Guidelines, and they're binded by that. That's legally what they do, and they do an amazing job at that, but they're not able to help out with the insulin. And so I have talked to the Department of Health and Education, and so they have listened to my concerns and other concerns, and Diabetes Canada has advocated on this issue also. But as of yet, there hasn't been any movement towards changing it.
Can Anna administer injections herself? Like, I know this has been ongoing for you for years, so is she able to do that yet?
So when she was young, like when we started off with needles, she wasn't able to do that. When we switched to a pump at age 4, she didn't know her numbers. Age 4-year-old probably doesn't know a 3 versus a 5. So it's kind of like a cell phone. You're literally punching in numbers for the lunch and pressing enter. So she wasn't able to do that. Now she does know her numbers and she is able to do it herself. It's having that extra kind of check and assurance that it's being put in, correctly. She is becoming a lot more independent, but way back in the day, and everyone, I know folks that are newly diagnosed now with littles, it's a lot of years of having to change your life.
Yeah, you're here for not just your family, as you outlined at the beginning, for others as well.
Yeah.
What was it like for you, just to get back to your personal story, though? Did you have to tell your employer, this is part of my life?
Yeah, for sure. I was able to get accommodation. So I was super lucky to achieve that. But again, lots of folks, depending on their job, even in healthcare, I know a nurse, I know a paramedic. She works in the Interlake. You can't leave your emergency call to go to your child's school.
So you've mentioned the division's been great through all this. What are you hoping might change at the the provincial level, because the division's saying they're strapped by the rules? What do you hope might change?
For sure. I would love for the URIS guidelines to change for public health nurses, URIS nurses to train school personnel. So that can be educational assistants. It could be the secretary. It could be resource teachers to help. And it's really with young children, working in partnership with the parents, just helping them administer. And with the proper training and observation, it could be very safe. And the risk right now of folks that aren't able to have this lunchtime dose is a lot of kids are riding high blood sugars all day. And so what that means is it's harder to pay attention at school, harder to learn, and their health, their long-term health is being affected. So there is risk. There's always risk in healthcare, but the risk of these children now not having the lunchtime insulin is also a risk.
You're talking about risk, so I'm just casting my mind to some of the challenges that might come if they do change the URIS guidelines, because obviously students come to school with all kinds of different needs, and if it's administering medication into a person's body, because that's what this is, they may say, well, that risk is a liability, and what if something went wrong and it was a school staff person, administering? What are your thoughts on that? That this may be well, and people can understand the desire for it, that it might not be something that can be achieved?
For sure. So Nova Scotia and British Columbia already have policies on this, and there's a double check. Nova Scotia actually, in their recommendations, they say the risk is the same, because right now, even folks not getting a lunchtime pump where you're pressing a button or a needle, you still have a huge risk. If they don't eat their lunch, they're going to shoot low and could have an emergency. So the risk, they say, is the same. And we do have all the frameworks for monitoring blood sugar, which are working exceptionally well. So
just to interject, in Nova Scotia, those other provinces, are they training all teachers to do this, or they have someone designated in the school? Like, they've made those changes?
They have policy in place already. And usually it's, around 2 or 3 people trained. So if someone's away, that kind of thing.
Got it. So we have a benchmark there that we could follow if the province chooses to. What's your message before you go this morning to other parents that are experiencing this as well?
We all want our best for our kids, and the tech of the insulin pumps is so amazing. You don't have needle anxiety. You're healthier, happier. You can be a regular kid. And I really encourage folks to go for it if you can. And I really hope the government can make a change as soon as possible.
Good luck with grade 4.
Thank you. Thank you so much.
Thanks for coming in.
Yeah.
That was Ashley McKague, a mother to a type 1 diabetic child, Anna. We did reach out, by the way, to the Louis Riel School Division, and this is their statement, which reiterates a lot of what you heard in our conversation there. Quote, the Louis Riel School Division follows the guidelines provided by the province, WRHA, and URIS. The guidelines allow us to monitor levels, but we do not administer insulin injections, unquote. CBC also reached out to the province for comment, and we have yet to hear back. Well, thanks for being with us on This is Manitoba. I'm Marcy Markusa. If it's your first time on our podcast, consider subscribing and following. And you can find us, by the way, anywhere you get your podcast. There's a new episode every Friday. Well, as I mentioned at the top, today is all about issues in schools, AI factoring prominently into what's happening in our schools and in our classrooms, but also into how we get information and how you study, right? So typically when you have a question, you turn to Google. If you're old-fashioned, you might go to the public library for a visit. You might spend hours flipping through pages and doing old-school research. But an increasing number of young Manitobans are turning to AI, to artificial intelligence, to solve their problems in their life and in the classroom. That means for Gen Zers, finding the right answer often sounds and looks like this. So here's an example. I'm just going to ask a question here. What are the main ways that Gen Z uses AI?
Great question. Here's a clear breakdown of the main ways Gen Z is using AI right now, based on 2024 or 2025 research and surveys. Number 1, education and productivity. Homework help, summaries, explanations, solving problems, brainstorming essays, project ideas, or study guides. Language support, translations, grammar checks, rewriting, career prep, resumes, cover letters, interview practice.
So that answer goes on and on. And of course, it is AI generated. Let's find out what real Gen Zers have to say about how they use it. The voice was ChatGPT that we were listening to there. Now, it did answer, but of course, is that the right answer? To have some insights on our panel today, 20-year-old freelance filmmaker Bridget Clemente is with us. Hi, Bridget.
Hi, good morning.
Nice to see you again.
It's nice to see you as well.
We also have Kyler Zaenali, 21-year-old Asper business student. Nice to see you as well, Kyler.
Hello, hello.
And in person, we promise, real people here, 19-year-old Red River student Rylee Gerrad. Good morning.
Good morning.
Nice to see you as well.
Hi.
So you guys all say that you have some concerns about AI, but you all use AI. How do you use it, Kyler? What's your relationship with AI?
Well, I use it as a tool. It's helpful in situations where you can't really get something out of your head, but you just need to get it out fast. So it's a great summary tool. It's a great idea generation tool in some cases, as well as it's just a great, get it out, just get a rough idea so you can come back to it later.
And were you an early adopter?
I was. Thank you for asking that. Yeah. I remember being there when it just started because I thought this thing's really funny because I can get it to say things in people's styles, like a president's style or a prime minister's style, how they would talk. And I thought that was hilarious to me at the time.
Got it. Do you still do that, or do you have new cautions about using it and stuff?
Well, I would use it. One of the most times I would use it would be when I'm trying to practice for something because it's a great back and forth and grading you tool. Like it'll always give you an option that you can use in the style that's best communicated to you. So things like that, I'll use it, but not very much to make me laugh anymore. I think it's a little bit weird. Got
it. Okay. Let's let you guys weigh in on this. So Rylee, what about for you? AI?
I think I use AI on about a weekly basis, so not quite every day. And I use it most frequently to help me understand something. So frequently if there's appliances I don't know how to use, then I'll use AI to help me kind of a step-by-step, how do I use this? Or if there's a problem or a word or just something I don't understand, I like that AI can tailor make a solution that I understand or explain something in depth that I understand.
Can you give us the appliance example? What's in your head? What are you thinking about?
I had to help fix the pool pump this summer at home, and I used AI this summer to help me understand how to fix that. And
so
it worked.
What did you do? Was it a ChatGPT ask a question of?
I just said, I'm having trouble. This is my problem. And I said, this is the model. This is the year, the make. This is the issue that I'm having. Can you walk me through in a step-by-step, easy to understand way to solve the problem? And it worked.
How about for you, Bridget? What's the role of it in your life, AI?
I would say I use AI once in a while. Like as a filmmaker myself, I would feel like we usually use it, let's say if we have writer's block, it's easy to kind of I guess
you were mentioning brainstorming too.
Yeah, brainstorming ideas, not necessarily copy what's on what the prompt says, but kind of make an idea out of what the prompt has already given, if that makes sense. Yeah.
So it's a creative tool for you.
I would say so. Yeah, in a way.
How often do you use it? Do you use it in your life otherwise, outside of being a filmmaker?
I would say so. I would say not, but it's kind of hard to strain away from AI because nowadays when you search something online, it's the first thing that pops up. That AI summary is the first thing that pops up. You go on social media and you have AI chatbots talking to you. So I feel it's kind of hard to strain away, but it's also easy to not use,
Yeah. So all of you talked about how you use it, and there's some positives in there, and then also saying that it's hard to get away from it. But what are the negatives, or what are the worries you have about it?
Well, I feel very, very strongly that it takes away the human experience of looking for something, and this is going to make people more likely to give up easier. So if you don't have that search and that difficulty and that journey and that human experience, that process to get somewhere, eventually you're just going to give up when you can't get there right away because it lets you get there right away, or maybe makes you think you got there right away.
And in terms of how you guys feel about it, the cautions around it, Rylee, what do you think about, what worries you about it?
See, my biggest concern with AI is information and disinformation. I think that, AI, it gets its information by reading the web. And so if anyone posts something enough, then AI gives you that information back. I'm in school studying journalism, and I believe in ethical journalism and journalist practice. And I think that using AI, it denotes that, and the amount of people that have told me that you can just use AI to write an article, it's I disagree strongly with that. I think that the human touch is really the strength in writing and things like that. So I think that information and division that's caused as a result of misinformation and disinformation I think AI contributes to that.
It's playing a role.
Yeah, exactly.
Bridget wants to get in, and then Kyler's hands up. So Bridget, you go.
Yeah, I feel like it definitely stunts humans like problem solving skills, I would say so, and also as well as literacy skills. Like nowadays people use it like for easy answers that you could easily use Google for. So yeah, I feel like it definitely would stunt our problem solving skills sometime in the future if we keep using AI.
Kyler?
I got two things to say. One, while I was in school, they talked about the idea of bias from AI because specifically if you're giving it a bunch of information to be trained on, that information, if biased, it will replicate bias. So it'll push to certain things, just like a human would. It only knows what it knows and it doesn't know what it doesn't know, right? And the second thing is, just a food for thought question here is that how much of this whole AI problem is the human problem and how much of it is actually the creation of it because we're partly to blame because we're always picking the easiest option. And if the easiest option is AI, then what are we doing here? Right?
So the what do they say? The horse is out of the barn now, all right? Like, so now we're at a chicken and egg argument about what came first, and you're absolutely right. So what do you do with that in the future? And you guys are the future. So what do you hope gets done with that in the future to make sure that this doesn't take off and become something that we build on the aspects that you mentioned concern you?
Well, I think that AI and ChatGPT use should still be taught in schools. I was in grade 11 when ChatGPT kind of came out, and I still remember the problems of you have to wait and can't use it because there's too many people on the server. And so I think that because AI is the future, I think that you should still be teaching AI in school because now a lot of companies use AI or use their own form of AI to help them in work. And I think that like education is supposed to prepare students for the future. So I think if AI is our future, the best foot forward is teaching students how to ethically use AI, knowing what it can do and what it can't do. And exercises that we do in school is identifying the difference between a human written article and an AI written article and seeing the differences. And I think that those are, good methods to teach AI and how it can be used correctly and the dangers of it.
I wonder in the creative space what you think the future is, Bridget, given that you're a filmmaker.
Well, it's a little scary, I would say. Like there's this kind of like phenomenon of like, oh, AI is going to take over our jobs, and that is definitely still in the back of like a lot of creatives. For AI to be built, I feel like it's kind of like it takes off from other artists to create a prompt, right? So hopefully in the future they find a way to not kind of like, I guess, like steal off or take inspiration from artists and basically create new out of other people or other artists' work, if that makes sense, right? So, yeah.
And Rylee, I'm pardon me, not Rylee, but Kyler, I'm wondering whether or not you have a perspective on how older generations misunderstand AI use.
That's a great point because when it comes to AI use and stuff like that, I think if you grow up with something, you're more tendency to like it more. So when it comes to AI in the newer generation versus the older generation, the older you are, the less likely you are to use it because, if you're older generation before smartphones, you didn't really get a smartphone, right? It's the adoption over the years. It's what you know and what you prefer. And so that's kind of the misinformation here. The gap here is that people who didn't grow up using it will not use it or will be less likely to use it because they have another technique of getting it. So if kids grow up with AI, they're going to use AI more frequently.
We've done a lot of conversations about AI in school, and you guys kind of addressed some of that at the beginning. So I want our last question to be about mental health. Only because ChatGPT recently added a mental health guardrails rather. This was in an effort for the tech to stop enabling unhealthy behaviors in users. What do you think when you hear that? Is that even possible?
I think it's a good idea. I think there's lots of stories of people who have had dangerous kind of encounters with AI, and I think that it's good for them to put up these mental health barriers. But I think AI in a way can kind of like be not like I don't think it contributes to mental health the best. Like I think if you're in a bit of like a creative slump and you're struggling to write or you're struggling to do something, AI is so easy and it almost becomes like a little cliff. You take that step off of, can you write this for me? Because you're just in a bit of a mental health slump. And I think that that's kind of also negatively can kind of contribute to AI is how easy AI makes things. And so it helps you fall deeper into that kind of slump. So I think that those kind of the unwritten dangers of AI.
And we haven't even talked yet about the fact that AI is always going to tell you you're great. So there's all these conversations now about if you become friends, with AI or a bot, it's always going to be on your side, which can be really good for loneliness. But on the other side, what perspective are you getting? What are your thoughts on mental health and AI? Bridget?
I feel like, I agree with what Rylee said. Like, I feel like you have to take precautions, and when you're talking to ChatGPT or any AI platforms that you're using, because they're taking your side. It's not really going to give you any other perspective rather than make you feel good about how you're feeling. It's great to talk to real people. They'll give you real answers and they'll give you different perspectives. So if you are going through some sort of like mental health crisis, ChatGPT could be good, but at least also try
at
to
the point
talk
of
to
crisis.
people.
Got it.
Yeah.
It's interesting because a lot of mental health professionals are talking about how it fits in and where those lines are as you're outlining. Kyler, last word. I'm mindful of our time here.
Okay. Well, I think that over from 2023 to 2024, the number one in 2023 use of AI was idea generation. 2024 was therapy. So there's a big connect here because people just want someone to listen to them and they want someone to agree with them. And if you don't have pushback on your ideas, you'll never know if you're wrong, or like you said, you'll never see a different perspective. And that's extremely important in mental health.
You guys are so thoughtful around all of this. That's our Gen Z panel for today. Thank you.
Thank you.
Thank you.
Thank you.
That's our Gen Z panel. Rylee Gerrad, who's 19, Bridget Clemente, who is 20, and 21-year-old Kyler Zaenali. By the way, if you want to weigh in on a topic you'd like our Gen Z panel to tackle here on the podcast, or if you have another idea for the podcast that you'd like to hear us discuss through a Manitoba lens, you can email us. Use our radio@cbc email, which is radio893@cbc.ca. This is Manitoba, and this was Manitoba for this edition of the podcast. Thanks for checking us out.